Hello, my name is Dr. Andrea McSwain, and today I want to speak to you about the sciatica. The sciatica is a nerve that is in the gluteus region. It is actually pathologic in some circumstances. I want to bring to your attention the piriformis muscle. That is a critical discussion related to sciatica because the piriformis muscle and the sciatic nerve have a unique relationship. Basically, in some people, about 20% of the population, they actually have this situation where the piriformis muscle, this is the muscle, it divides, and then the sciatic nerve comes through it. So the piriformis can tighten around the sciatic nerve, therefore pinching the nerve, which is often said. Pinching the nerve happens when the piriformis gets too tight. The piriformis is involved in our hip rolling out. And when our hip rolls out or when our leg muscles get weak and we start to rely on our lower back for stability, then the piriformis, in some people, it can actually trap the sciatic nerve. Now, some people just have the piriformis as one unit, all the striation is together, and so the sciatic will go above it and below it. In very unfortunate circumstances, which are very few percent of the population, the piriformis actually has a few openings and the sciatic nerve has branches that go through this piriformis. And that can be very, very extremely painful. But it's very easy to treat, almost never requires any kind of injection or surgery. There's many YouTube channels that have Sciatica Stretch, which you can look through those. They divide into two groups. And I'll tell you, if you think about your legs centrally, and then some people, for the sciatica pain or the piriformis being too tight, they need to stretch that by crossing their leg over the midline. Other people do really well to get the sciatica to turn off and the piriformis to stretch by rolling their hip further out. I have found that most people fall into those two schools. And so if you are noticing some of the stretches don't fit you or make it worse, then what you want to do is you want to try it the other way. And I find it's kind of 50-50. You can't really determine who will respond to the crossover versus the rollout. And so I can generally show you what that means, but I would say there's several sciatic nerve stretches that are available on YouTube, and many of them are very, very good. So I'll just show you briefly. Basically, if you lay on the ground, and this is where it's on the same side that you have the pain, and you lay on the ground and you would just cross your leg over and feel the stretch here. Now you don't want to go all the way over because you're getting into your back here with twisting. You just want to ground this other leg either with a bent foot or you can lower it down, and then you take your hand right here. Take your hand and just take it barely over midline. Now, other things you can do too, activate the foot by pressing out through the heel or relaxing the heel and letting the foot flop down. You definitely do not want to be doing this because that will not be in the sciatic. And then you just relax. Some people will stretch their leg over the other knee. That's fine too. Basically, this part of the hip is what's having the problem. Then if you go back, some people do really well. They put their leg out. And then the other trick for that particular person, and I'll show you just on the other side, is to actually bend the leg. And so it is flat against the wall, the ground rather, and then you feel that stretch right in here. And then you want to hold it at least 90 seconds to possibly 5 minutes, and that will help get more blood supply, increase circulation, and then as a result you'll note improvement. That is sciatica nerve pain. If you have any questions or comments, please leave them below. Thank you so much, and I hope you have a beautiful day, and definitely want to address your sciatic nerve pain, preferably with an osteopathic physician. Chiropractors and physical therapists are available, and then there are some very competent personal trainers as well who can deal with those issues. Once you get the stretch and you feel relief with the sciatic nerve, and the piriformis. The goal then is to create strength in the inner thighs, the quads, the glutes, so that piriformis muscle is not being responsible for maintaining your balance or you standing. Your standing posture should not rely on the outside of the hips. They really should rely on the thighs, both the inside of the thighs, some on the outside, and definitely in the front, as well as the glutes. So that is the next step, and definitely personal trainers who are competent and qualified, and there are many of them, can help you with that and get that strength going. And then you don't have to worry about sciatica again. And if you do, you know how to deal with it right away, so your pain level is minimal and your issues are addressed, and then you know you need to get stronger. Thank you so much.